Alam mo, ang how is that experience? Hi, welcome to TAT. Our guest right now is one of the best doctors in this country, a gastroenterologist, a friend, and he's going to talk about the life of being a frontliner and what it is to be a doctor today. Please welcome Dr. Dennis Ngo.
Hello, boy. Hello. Good evening. Hello to everyone.
I'd like you to meet Sky and Clark and Gabby.
Hello,
Hello
Gabi.
po.
Hi,
Hello.
Clark. Hello.
Alam mo, ang gusto kong pag-usapan natin una ay sintomas. Ano ang pagkakaiba ng sintomas na hindi COVID at sintomas na COVID?
Kung ikukumpara natin ang COVID saka ordinary flu or influenza, halos pareho ang symptoms. Walang malaking pagkakaiba. Pero ang COVID kasi, sa nakikita natin sa clinics, parang more progressive. Ang progression niya from fever, pagsipon at ubo, parang mas mabilis. Bukas, parang mas grabe na. Kaya pag may high level of suspicion ka, pinapatest namin, hindi exactly sa swab or what. Pinapa-CBC, pinapa-chest x-ray, dahil may mga telltale signs na makikita natin na, oy, parang pa-COVID to ah.
Do you advise people to go straight to the doctor, to call? What do you advise people to do?
Just be calm.
That's the hardest to do.
Kalmado ka
The
lang.
hardest to do.
Right.
Dito sa mga sintomas, may nagsasabi naman na hindi pwedeng nauuna yung hirap huminga. Is that true?
Pwede, pero kadabihan fever.
Pero yung diarrhea at saka yung loss of smell, ito ba yung mga sintomas?
Yes. Ang diarrhea may be one of the manifestation ng COVID. Kaya kami mga gastroenterologists, nag-alert na to the community na if you have diarrhea, na wala naman source, I mean, kumain ka ng maayos and everything, and yet nagkaroon ka ng pagdudumi ng tubig, isa sa mga konsiderasyon natin ng COVID. Meron mga kasama ako dun sa Frontliner. Nagkaroon siya ng second infection. And the second time around, kinuwento niya talagang totally wala siyang maamoy, wala siyang malasahan. If I were to look at the other patients that I've encountered, not all of them will give me the same manifestation.
Yung swabbing lang, how trustworthy is that?
The swab test is the one that we recommend. It's more accurate. Ang kanyang yield for positivity, the real one, is exponentially higher and more accurate than your so-called rapid test.
Mhm.
Dahil ang tinetest dyan, hindi meron ka bang COVID o wala.
Anong tinitest dyan?
Meron ka bang panlaban o antibody?
Tama po ba, Doc? Maglalabas lang yung body mo ng antibodies if nagkaroon ka. Kasi lalabanan ng katawan mo yung virus na pumasok sa'yo. So that's why the antibodies yung tinetest sa rapid test. Tama ba?
Tama. The accuracy will come usually on the third week.
So, kunyari po, Doc, yung sa swab test, even day 1 na infected ka, masisense niya agad as compared sa rapid test na 3 weeks pa.
Ang recommendation is for swab on the 4th to the 5th day.
Ano naman po yung antigen testing? Pwede rin po ba ito sa COVID-19?
Yeah. And it's more specific towards COVID kasi antigen. Ibig sabihin, meron ka bang virus na ito sa sistema mo?
How is it done?
Swab, same process. Ang maganda lang nito, ang result comes out fast.
Does it have the same accuracy, the RT-PCR and the antigen test?
Yes, the table which we will be showing you will show you that the accuracy is almost the same as the swab. Both swab tests.
For example, ikaw, yourself, you're exhibiting some symptoms. When do you know kung kailan mo na kailangan pumunta sa hospital? Ano po yung signs na pwedeng i-consider for yourself?
If you think you cannot handle it at home, in other words, not because you just have fever. If your fever would respond to the antipyretic or to the paracetamol, and then it would not recur, it would not spike again, That means to say your fever is responsive. Your body is still fighting back. You don't need to go there.
Sino bang dapat magpa-test?
You may symptoms lang.
What if you're asymptomatic?
Why would you have a test? If you look at, again, the requirement, once you get infected, for example, you have a positive result, you keep yourself quarantined 14 days just because you are mild, just because you're asymptomatic. You don't even need hospitalization. You don't even need treatment. Just keep yourself out of the community. Then after that, you don't need a retest.
Tayo, bilang citizens of the country, we have a responsibility to be part of the solution. Tama yung sinasabi nila, palakasin nyo ang immune system ninyo. Tamang pagkain, exercise, tamang tulog. Tama yung sinasabi na ito?
Tama. I have many calls, teleconsult. Many of them are worried because they feel they have COVID. Just because they have a little bit of headache, when they woke up, a little bit of cough, immediately they turn into this kind of a negative way of thinking.
Pero Dennis, kumusta ang buhay ng isang frontliner? Your life is different. You're exposed to COVID patients. How is that experience from the lens of a doctor who is in the front lines?
The first few weeks, the first month, March onward, was scary because it's really facing the unknown. The progression of the illness is, for us, too fast. You see death left and right. It's very painful. It's very difficult to the point that you would think, worth it ba? You know, with all the layers of protective equipment and clothing.
So when you say, is it worth it? What was your answer?
Yes, it's still worth it to see at least one human life that you can help and save. Everybody is taking their own risk, not only doctors, even our janitors, our orderlies who pick up the waste products, the tubings, the garbage collectors. You don't know. We're not very sure what are the other modalities or manner where the virus can be transmitted.
You don't think of your payslip.
No, you just want to see this patient walk out alive and well. That is why when you see social media posts of patients being wheeled out alive, hindi OA yun, totoo. Kasi to see one recover perfectly, it's really heartwarming. It's really very nice.
Pag-usapan natin itong pinag-uusapan sa buong mundo, itong mga vaccines. You heard about it, Dennis?
Yes.
Ivermectin. There was a doctor who came out and said that this is effective.
There are many medications now being given, from antivirals to steroids and other supportive medications. With the just recently concluded Philippine College of Physicians Convention, there's no single medication that could be used to address this particular pandemic or this particular coronavirus.
Okay.
That is why the treatment protocol that we are using among patients that we have in the intensive care unit or those who are experiencing severe or critical manifestations, we are treating the symptoms. We are treating the complications that this virus had created.
Yung ano po ba, convalescent plasma?
The convalescent plasma therapy is kukunin mo yung plasma component or the liquid component of blood mula sa isang tao nagka-COVID na at gumaling. At isasalin mo, itatransfuse mo sa isang taong may severe infection.
So nandun yung antibodies nung katawan?
Hopefully. Again, we don't have adequate studies to say it would work, but the experience of certain infectious specialists would say it does improve.
May negative effects yun.
Remember, blood is an organ. Parang ka nag-organ transplant ang blood transfusion. So you expect rejection, you expect reaction, you expect some immune response. And sometimes it can cause shock. That's why when you do convalescent plasma therapy, it should be type specific. Your type A, I give you type A. Hindi pwedeng to anyone.
Doc, meron ngayon sa social media yung, nakita nyo ba yun, yung sa pool, sa Wuhan, na ang dami, like thousands of people are no social distancing, no masks. So, I think they championed this battle in COVID-19. And I think one of their medicines now is the Chinese medicine, Linhua.
Yes.
Do you recommend the Chinese medicine for Filipino patients of COVID-19?
Well, it was recently approved by Dr. Eric Domingo explained it to you, the FDA.
Yeah, he was here, right.
We can use this to patients who are established to be with mild symptoms, and it is only taken for 4 days. It's not forever. Wag na wag siyang inumin bilang protection or prophylaxis laban COVID. Baka isipin nyo, uminom ka lang nito hindi ka nadadapuan. That's very wrong.
The last episode of TAT, we talked about Sputnik 5. We talked about 6 vaccines
Stage
na nasa 3rd stage na ng clinical test. Even with the presence of a vaccine, hindi ito mabilis. Matagal pa rin, di ba? What is your medical prognosis in the context of vaccines?
Prevention is still the key. We can reintegrate into the community. Wearing of masks would help. Social distancing. I won't say learn to live with the virus, but we have to be aware and beware of this virus so that we are not an agent in its transmission.
So, Dennis, is going to happen that, this virus is going to stay for years and then we just get used to, taking good care of ourselves. Posible na ganun ang mangyari.
Pwede naman.
Masasanay lamang tayo.
Yes.
There are a lot of people posting about COVID na people daw are being too paranoid. How would you explain COVID to people like that po na hindi naniniwala na totoo talaga siya na threat sa atin?
Not until na-experience nyo mismo ang COVID. I have mentors who died, colleagues of my age who died. I have younger students who died, some near death, but they survived. You will see that this is something real. Not until it reaches home, you will never understand. As far as COVID is concerned, hindi pa natin alam kung hanggang kailan. Ang kailangan lang natin gawin yung pansarili na lang, talagang protection, prevention, hygiene, hand washing, social distancing, and kung talagang hindi kailangan lumabas, iwasan natin muna. Yun lang magagawa natin. Do something from your standpoint. Huwag tayo masyadong mag-blame o mag-rely sa iba mo.
Maraming salamat.
Thank you very much, Boy. Thank you very much.